We hope you're having a great week. This week we're going to talk about a fairly hot topic as it relates to lead poisoning with the Flint water crisis and other lead poisoning issues and problems that have arose here in Illinois, around the Chicagoland area and elsewhere. We wanted to make sure that you knew what your obligations were as a healthcare provider as it relates to children and lead poisoning. And so if you did not know, the Illinois Lead Poisoning Prevention Act labels you as a healthcare provider that is required to do lead testing or to refer or to report lead testing for children who are 6 years of age and under. Previously, we had reported that it was from 6 months to 6 years, but the bottom threshold has actually been removed from the law now, and we're only dealing with children who are 6 years of age and under, and those all fall under your obligation to either do lead testing or refer them out or go through a questionnaire. So if they're in a high risk area, they automatically fit into the category of having to do the blood testing. If they're not in the high risk area, then you must walk through a questionnaire, and we recommend that you actually use the questionnaire, fill it out, and make it a part of their medical file so that you can actually prove that you've fulfilled your obligation and requirement under the law. And so the questionnaire, by the way, if you'd like to Google it, you can pull that up that way. It is the Childhood Lead Risk Assessment Questionnaire. So the Childhood Lead Risk Assessment Questionnaire. And again, you can Google it, pull it out, print it out, and have it available in your office to be able to utilize for those of our doctors who treat children 6 years of age and under. And in those cases, you just walk through, and if you answer yes or I don't know to any of the 9 questions on the questionnaire, then they also fit into the same category as those patients that would be in the high risk areas. Some of the questions that it does ask is, does this child have a sibling with a blood level of 10 or higher? And in those cases, if you can't say no, then you would automatically put them into the category of reporting, if you will, or of having to do the blood test. Now, the other questions on here is, is a child a refugee? Or in the past year, has a child been exposed to repairs or repainting or renovation of a home built before 1978? Do they live in a home that was built in 1978 or before? All of these questions are on the questionnaire, and if you answer either yes or I don't know to any of them, then of course they fit into the mandated reporting or mandated lead testing category. Now, if they do fit into that category where they have to do lead testing, then at that stage you have a number of different options. So there's really no reason to necessarily panic at this stage, because if you don't have the capability in your office, of course it's going to be tough to fulfill that, but that's okay. You carefully document everything that you would do here, and in those cases you can actually refer the patient over to the local Department of Public Health or to a Department of Public Health approved provider or tester. In those cases, you can also actually do the blood draw yourself and send it off to an approved laboratory. You have additional responsibility of reporting in those cases, but if you actually refer the patient and their guardian or their parent to the Department of Public Health, you begin to shift some of the liability for reporting onto that other entity. You've fulfilled your obligation at that stage. So we would encourage you to really look closely at this. Make sure that you print off the form and begin to utilize this in treatment of those minors who are 6 years of age and under. If you'd like to have more information on this mandated reporting and other mandated reporting requirements, please jump on our webinar that we have next Tuesday at 12:30 p.m. right over your lunch hour, hopefully. And you can jump on and find out about this and many other required mandated reports that you have to make as a physician. Try to make it as simple as possible for you and be able to utilize these and put these into place in your office immediately. And so they're not onerous and difficult for you to put into place, but instead continue to make sure that you are compliant and also can operate an efficient and profitable business as well. We'll talk to you next week. Thanks for tuning in.